The UK is nearing the target of offering a coronavirus vaccine to 15 million people in the 4 highest priority groups by Monday, but the amount of jabs given out differs hugely from a total of 14,556,827 million people in the UK have now received a first dose of COVID-19 vaccine, according to government figures published on. This is the equivalent of 21.8% of the total UK population, and 27.6% of people aged 18 and over. Based on the latest figures, an average of 221,587 first doses of vaccine would be needed each day to meet the government's target of 15 million first doses by February. New figures show how each UK nation is faring in the areas of England that are delivering jabs much faster than others. The Midlands is leading the way with a vaccination total that is 66% higher than that of London, which ranks low. Have you been affected by coronavirus? Email webnews@mirror.co.uk. Wales has inoculated just under 30% of its residents aged 18 and over, tops among the 4 UK nations. It is followed by England, just under 28%, while Northern Ireland is third, 7%, and Scotland fourth, 25.5%. Government data up to February 12 shows that of the 15,091,696 jabs given in the UK so far, 14,556,827 were first doses, a rise of 544,603 on the previous day. Some 534,869 were second doses, an increase of 4,775 on figures released the previous day. The 7-day rolling average of first doses given in the UK is now 441,660. Now that most of those in the top 4 priority groups have been offered a jab, the health services are moving on to the next groups. Here are the detailed figures for each UK nation, with a regional breakdown for England by region. The Midlands has leading the way for vaccinations, followed by the South East and North East, and London is lagging behind every other region and is last for total jabs and first. Here is a breakdown by region based on NHS England data between December 8 and February. Midlands, 2,415,791. 2,343,336 first doses and 72,455 second doses. Southeast, 2,074,342, 1,989,855 first and 84,487 second doses. Northeast and Yorkshire, 2,003,006, 1,921,673 first and 81,333 second doses. Northwest, 1,698,709, 1,629,615 first and 69,094 second doses. East, 1,536,889, 1,477,199 first doses and 59,690 second doses. Southwest, 1,486,769, 1,429,813 first and 56,956 second doses. London, 1,449,924, 1,386,637 first doses and 63,287 second doses. A total of 12,246,166 people had received a first dose of COVID-19 vaccine up to February 12. According to NA, this is the equivalent of 21.8% of the total population of England, and 27% of people aged 18 and over, based on the latest population estimates from the Office for National Statistics. The latest available breakdown for age groups in England is for doses given up to February 7. By this date, an estimated 91.3% of people aged 80 and over had received their first dose, along with 95.6% of people aged 75 to 79 and 74% of people aged 70 to 74. A total of 93.2% of residents of older adult care homes in England eligible to have their first dose of COVID-19 vaccine had received the jab up to February. Residents are classed as eligible for the vaccine if they have not had COVID-19 in the previous 20 years. NHS England said the number of eligible residents includes a small number of residents at care homes currently undergoing an outbreak and which cannot be visited, who did not receive the vaccine for valid medical reasons, and those for whom consent had not been. It has said the top 4 priority groups in England, people aged 70 and over, Care home residents and staff, health and care workers and clinically extremely vulnerable patients, have now been offered the opportunity to be vaccinated. NHS England said people aged 65 to 69 can now get a vaccine if GPs have supplies, while Welsh First Minister Mark Drakeford said they had already begun contacting some over 50. Wales has also said those top 4 priority groups had been reached. As of 10 p.m. on February 12, 445 people had received their first dose of COVID-19 vaccine, according to Public Health Wales. This is the equivalent of 23.8% of the total population of Wales, and 27% of people aged 18 and over. A total of 89.1% of people aged 80 and over had received their first dose, along with 84% of people aged 75 to 79 and 84.8% of people aged 70 to 74. The latest figure for care home residents is 81.2%, and for care home workers it is 84%. Public Health Wales said people may appear more than once in these total. For example, someone aged 80 and over who lives in a care home will be included in the percentage for those 80 and over and also in the percentage for those in Scotland. As of 8:30 a.m. on February 13, 173,445 people had received their first dose of COVID-19 vaccine, according to the Scottish Government. This is the equivalent of 21.5% of the total population of Scotland, at 5% of people aged 18 and over. Some 98% of people aged 80 or over living in the community have had their first dose, along with 96% of people aged 75 to 79 and 72% of people aged 70 to 74. These totals do not include care home residents. Some 94% of residents in all care homes have had their first dose. The figure for staff in older adult care homes is 91%, while the figure for staff in all care homes is 79%. Scotland's First Minister Nicola Sturgeon has said she expects many in the 65 to 69 age group to have had their first jab by the middle of this month, after the vast majority of older people were. Northern Ireland, a total of 387,771 people had received a first dose of COVID-19 vaccine as of February 12. According to the Northern Ireland Department of Health. This is the equivalent of 20.5% of the total population of Northern Ireland, at 7% of people aged 18 and over. As of February 4, 100% of care homes in Northern Ireland had been visited and offered the first dose of the vaccine, while 90% of care homes had been visited and offered the second dose. A recent breakdown of vaccine doses by age group is not available. In Northern Ireland, the Department of Health is offering everyone over 65 a vaccine by the end of February as it works its way through priority groups 4 and 5, although it is expected to help the UK meet its overall. What are the first phase priority groups? Residents in a care home for older adults and staff working in care homes for older adults, all those 80 years of age and over, and frontline health and social care workers, all those 75 years of age and over, all those 70 years of age and over, and clinically extremely vulnerable individuals, not including pregnant women and those under 16 years of age, all those 65 years of age and over adults aged 16 to 65 years in an at-risk group, all those 60 years of age and over, all those 55 years of age and over, all those 50 years of age and over, rest of the population, to be determined. PM optimistic about prospects for easing lockdown. Boris Johnson has said he is optimistic he will be able to set out plans for a cautious easing of coronavirus lockdown restrictions in England later this year. The Prime Minister said that while the overall number of cases remained high, the infection rate was starting to fall while the rollout of the vaccination program has made huge progress. I'm optimistic, I won't hide it from you. I'm optimistic, but we have to be cautious, he told reporters during a visit to a vaccine manufacturing facility. Sign up for the Mirror Politics newsletter from the coronavirus to Brexit. This is an era of great change, and events in Parliament have rarely been so crucial, or confusing. Our daily politics newsletter is 30 a.m. to guide you through these turbulent times. Written by the Mirror's head of politics Jason Beattie, it includes sharply written commentary, a concise overview of events in Westminster, and a sprinkling of there's then a 4:30 p.m. bullet point update with the day's headlines. Don't miss a thing. Sign up for the Mirror Politics newsletter by visiting www.mirror.co.uk/email. His comments came as scientists continued to urge caution over the easing of the current controls when Mr. Johnson sets out his roadmap out of lockdown for England on February 20. Professor Stephen Riley, a scientist advising the government, said ministers risked a third wave of the pandemic as big as the current one if they moved too quickly, while senior NHS figures said the health service remained under huge pressure. Ministers, however, are confident the vaccination program is on track to meet the target of getting an offer of a jab to everyone in the top 4 priority groups, including the over 70s, by the deadline of Monday. Mr. Johnson said the efficacy of the vaccines in helping to drive down infection rates would be the key to determining how quickly they can ease. Although the number is beginning to come down and perhaps starting to come down quite fast, we need to look at the data very hard, he said. Something also that will be very important is the efficacy of the vaccines. Are they working in the way that we hope that they are? And making sure they are really helping, along with the lockdown, to drive down. That is the key thing. The Prime Minister said that the government's priority remained the opening of schools in England on March 8, to be followed by other sectors as conditions